Hi, we are Open Ears. We are very excited to be here with you today and to present our idea. We have had the privilege of working closely with the hard of hearing and deaf communities to explore the topic of the daily struggles they face and aim to remove barriers in healthcare.
6 में से 1 लोग ऐसे रहते हैं. Do you understand? What if we wrote it down?
What about now? Can you understand? Well, most people don't know, but BSL is a language in its own right. So if you can't read Hindi, how do you expect those who speak BSL to understand English? Because sign language doesn't translate literally into English.
1 in 6 people experience some form of hearing loss during their lifetime. Unfortunately, day-to-day activities that we would find simple become more difficult for these individuals. However, some simple solutions that we have come up with over the past few weeks we hope can improve communication.
Our goal was to raise awareness of day-to-day issues that those who are hard of hearing or deaf face, and to empower the public to communicate better by providing helpful tips and tools. As well as this, we hope to also empower the deaf community to speak up and receive equal treatment.
We found that those who are deaf or hard of hearing are commonly mistreated in multiple disciplines. In particular, the deaf community told us that they find healthcare settings particularly challenging. We found out that people may go to the audiology department and don't hear their name, and as a consequence miss their appointment as there is no screen displaying whose turn it is. We spoke to members of the community to try and understand their experiences a little better.
This is Elaine. As part of our research, we went to Ninewells, where Elaine discussed a complaint she made with members of the board. She was in hospital for 12 days without an interpreter. She had to sign a consent form which she wasn't able to understand, and she had an operation and still to this day has no clue what she had done. This situation is totally preventable. Now think how different her story would have been if someone had booked that interpreter.
One of our key insights is that awareness is still shockingly low. We learned as a group that there were small changes everyone could make to help make a difference. These changes begin with empathy and awareness. We spoke about how at school we had taken part in awareness days, where we experienced different sensory deprivations which left a lasting impression. We felt this helped us appreciate how difficult everyday tasks became. We felt there was a need for a similar tool to experience hearing loss.
This is the product we came up with to help improve awareness. It comes with ear defenders, earplugs, a mask, and different cards which simulate different scenarios.
It is meant to be a fun, interactive and engaging experience to raise awareness. It includes the card you all have with tips to help, and it also an instruction card which helps explain how our box works. We felt that online resources don't offer the same experience one can gain from using our product.
There are 3 categories which are aimed to stimulate problems faced by those who are deaf or hard of hearing. We made this box out of low-cost materials. There is no need for training and no facilitator needed, meaning that it can be used anywhere by anyone. It is not too big, meaning it fits on a shelf, and there's nothing on the market like it.
This is one of the scenario cards. As you can see, there is a consequence of what can happen if this scenario occurs in real life. We are now going to perform a scenario card to show you how the box works.
We have been informed that due to there not being anything like our product on the market, that there is a need for it. We have also been told that it would complement the deaf awareness training that is already available. We've had feedback from the Deaf Hub, lecturers, medical staff and the head of nursing at Ninewells that they could see it fitting in well with training already given.
Thanks very much for listening, and if you want to give our project a try, our prototype will be available after the presentation. A special thank you to DeafLinks for all their support in helping us. Do you have any questions? Once again, we are Open Ears. So as you know, Global Health Challenge presents students with a wide range of healthcare issues, and last year we took up the issue of hearing impairment. And what we found as we did our research was that it gets complex very fast. We're not going to solve deafness overnight. So we honed in really on awareness and educating people on what they can do in their day-to-day life to improve the quality of life for deaf people. The way that we did that was by developing a portable toolkit that contains equipment for making you deaf and a deck of scenario cards Basically, it's like a little game that you play between two people. And it's things like shopping lists, getting prescribed medication. Sometimes we did like airport things. And it teaches you in a really short space of time how to improve your technique. So it's like, speak to the person, look at them so they can read your lips. Don't cover your mouth, because as humans we look away all the time. Touch people on the arm to get their attention. But I can tell you that over and over and over, and because it's just so ingrained how we behave and how we communicate, you really need to experience it, and you get like that moment where you get it and you understand what it's like to be deaf, and that's what we're trying to do in 5 to 10 minutes with our toolkit.
So we have 3 cards here, which consist of the speaker card, the hearing impaired card, and a content card. So the scenario that we're going to be doing today is medication. So right now Charlie here is going to be wearing ear defenders so that she can't hear anything. Can you hear me? She can't. So basically, I'm going to be the GP, and my partner here has been prescribed new medication. I'm going to list there are a list of medications on the content card, and I'm gonna say one of the medication's names and how many times it should be taken, and then Charlie is gonna try guessing what I said. This can be very difficult and potentially dangerous for people with hearing loss. We have to remember that BSL is a different language, which is British Sign Language, and users may not be able to read written English. So, take Lenoxin PG tablets, 100 milligrams. Take 2 in the morning.
Can you repeat that?
Take Lenoxin PG tablets, 100 milligrams. Take 2 in the morning.
Is it this one? Take glucophage?
No, it was take Lenoxin. So, as we can see, Charlie here could have easily taken the wrong medication, which could have led to other problems as well. So it's very important when you are speaking to someone who is hard of hearing and who is deaf that you are very articulate, are loud, your voice shouldn't be muffled, and you do maintain eye contact.